Welcome everyone to the July 2025 MIDAS monthly webinar. Uh, this month, it's my pleasure to introduce Majid Bani-Yaghoub. Uh, Majid is a professor of applied math at the University of Missouri, Kansas City, UMKC. His research focuses on modeling interactions within and between species, human exposure to zoonotic diseases, and the spread of antimicrobial resistant microorganisms across farms, communities, and healthcare settings. A topic that we should all have some personal interest in, I would say. His work emphasizes the need for an integrated One Health approach to address cross-environmental disease transmission and control more effectively. So today, Dr. Bani is going to talk to us about data-driven model of farm community hospital networks for mitigating antimicrobial resistance. And so with that, Dr. Bani, please take it away. The floor is yours.
All right. Well, thank you so much, Harry. This is a wonderful introduction. Let me share my screen with you all. And I hope that wherever you are having a wonderful Friday and enjoying your time. So I'll be honest with you, I have many slides to present. So I try to not to get stuck with too many of details and just move on. So this talk is a combination of three small talks that are related to each other. So it's data-driven modeling of farm community and community hospital, and then farm community hospital networks for mitigating antimicrobial resistance. I would like to start with funding and collaborators. So the research that I'm presenting here is primarily funded by CDC. It's Midwest Virtual Laboratory of Pathogen Transmission and Healthcare Setting, or MVL Paths, which is this year is the last year. And another funding associated with this is from National Science Foundation, which is having a focus on impacts of climate change and extreme weather events on zoonotic spillover. So that is still in effect until 2026. You can see the universities, the schools, and organizations that are collaborating with us. So Kansas City, Missouri Health Department, University Health, Truman Medical Center, School of Medicine at UMKC, School of Science and Engineering, and our collaborators at UC Davis Veterinary Medicine. So the three aims of this research are studying or modeling the effect of farm worker actions on dynamics of antimicrobial resistance. Second aim is effect of healthcare worker actions on dynamics of antimicrobial resistance, and effects of caregiver actions on dynamics of antimicrobial resistance. So lots of antimicrobial resistance. And you can actually see the names of professors and researchers that are collaborating, and they're basically leading these three projects. And I also want to talk about the CDC predoctoral fellows, that they have been excellent and they have done an excellent job pushing forward the research. So Ravi is a PhD student in computer science. He's expected to graduate in spring 2026. Julia is a PhD student in statistics, and she also has a law degree. So we've been very fortunate. Now, actually, she moved from UMKC to Cornell University, and she's also expected to graduate in spring 2026. Kyle is a PhD student directly working with me in statistics, co-discipline biomedical, and health informatics. He is expected to graduate by the end of this year, and so is Arash. These students have been publishing many papers, but before getting there, I also want to mention about this virtual laboratory, because that was one of our promises for CDC, to create a laboratory that professionals, researchers, and everyone can actually join and use the platforms to try different case scenarios according to their data sets. And very soon, we're going to put all these GitHub pages in one main GitHub page. And we also have an AnyLogic page that you can actually use the coding and try it according to any hospital setting that you may want to try. Work done by CDC fellows. They have been developing the virtual laboratory under supervision of the researchers. They have published 6 papers. They have submitted 4 papers, and they're currently working on 4 other papers. And at least they have presented at least 35 times in different conferences. And I think the number is much higher than this. So these are just few examples of papers. In fact, this paper published by Arash is One Health modeling. So I'll spend a little bit time talking about the impacts of biosecurity compliance and basically actions of farm workers on the spread of infectious diseases. This is another one is about the impacts of basically predictors that we have from demographic, hospital, and socioeconomic, and see how we can predict the UTI, urinary tract infection, which is related to E. coli, in fact. Agent-based modeling, a paper by Kyle, and this paper by Ravi. So we have been very fortunate that these dedicated team of predoctoral fellows have been very productive and working together. So for today, I am focusing on 3 talks, 3 mini talks. I have to leave behind lots of details. I apologize for that because it's just a lot of different modeling approaches, many data sets that we have analyzed and so on. So why is it important to model and analyze antimicrobial resistance? Probably you've seen this graph some time ago. This is a prediction of the year 2050. By the year 2050, it is predicted that AMR mortality will reach to the same level of cancer mortality. So it'll get to 10 million or even more around the world. So this is a major concern. It has always been a concern, but the concern has increased, especially for certain pathogens that are a lot more prevalent nowadays compared to the past. So speaking of those pathogens and infectious diseases, so this is the report by CDC in the year 2023 that is comparing the cases of these different infectious diseases prior to COVID-19, during COVID-19, and after that. So we can actually see that it is increasing. And the 2 rectangles that are showing here, so these are related to drug-resistant Enterobacterales, and these are the ones that we are going to focus today in this presentation. So you can see that one of them is urgent, the other one is serious, and they have been increasing. And even if you look at the data after 2022, you can see that the numbers are still increasing or stable. So we didn't notice any decrease. And Enterobacterales, so the order of Enterobacterales, and then the family of Enterobacteriaceae, so they have been all over places. They have multiple reservoirs. They can survive in the environment. They can even grow in the environment. They are in the intestines of human beings and mammals and many other animals, and they can live within and between hosts. 2 main pathogens that are members of Enterobacterales are Salmonella and E. coli. Despite being considered as subclinical, these 2 pathogens can be deadly, especially when they become antibiotic resistant. So the focus of today's modeling and research is in fact these 2 pathogens. So in general, if you look at the Enterobacterales or the family of that, you can see that it has cost a lot of money for healthcare system, over $1 billion. Unfortunately, the mortality over 9,000 and hospitalization of 197,000. So this is the data from 2017. And you can even look at the bar chart that from 2012 to 2015, the cases of ESBL producing Enterobacterales have been going up in hospitals, and also in some communities we can see that. So and 2024 CDC funding priority questions that are related to ESBL producing Enterobacterales are as follows. So what are the key determinants of infection or pathogen transmission in different community and healthcare settings? And why are these rates of these pathogens or community-associated infections, especially ESBL producing Enterobacterales, why are they going up? And how does the prevalence of these antimicrobial resistant pathogens in the community influence the healthcare associated infections, and in particular complications in certain infections such as sepsis or complicated UTI and all of that in healthcare facilities. So we can take a look at the CDC NORS data. This is 2009 to 2023, and the last 2 years data is not available. And you can actually see a word cloud of etiologies, and you can clearly see that E. coli and Salmonella are the words that are appearing bigger, and probably after norovirus, they are the biggest. And why are we looking at this 2009, 2023? Why not prior to that? The reason is that NORS and in general, data collection for outbreaks has evolved quite a bit from early 70s. That data was collected through pencil and paper until 1997, that a new surveillance system came into play, and that was for foodborne diseases. And then in 2009, that was combining all of these into a system known as a National Outbreak Reporting System, which is NORS. And more cases of outbreak were reported. So if you look at this data, we have to be careful. It doesn't mean that outbreaks have been increasing a lot compared to 90s. It's just showing that the system is now working a lot better, and it's collecting data more efficiently. You can also see these oscillations that have been prevalent. So it's a lot more the frequencies and oscillation that are associated with the seasons. In 2024, so CDC data modernization initiative came into play. So even this one that we're seeing is for the surveillance system is going to further be modernized. When we look at the Salmonella and E. coli, we can see that Salmonella and E. coli are among top 10 outbreak causing pathogens in the US. So we look at the data for different periods, and you can always see that Salmonella and E. coli are part of them. Other interesting observation of NORS data is this periodic behavior. So the top time series data that you can look at is clearly showing the peaks and valleys that are not exactly matching with each other. So the red one, which is for all other pathogens, are having peaks in sometime around winter, and the blue, which is for Enterobacterales, is happening in the summer. Bottom figure, you can actually see that the major contributor of all other infections is norovirus. So that's shown with this black curve, and then the blue one is for Enterobacterales that is happening, that is increasing during the summertime. Further analysis of data before we get to the modeling. So we can see that there are 7 states that are always among top 10 states in terms of number of outbreaks per million per year. So you can see the list on the map. So, but we have to be careful. That doesn't mean that it doesn't necessarily mean that those states are having a lot more outbreaks. It could be that some of those states have a better system of reporting, or they are reporting the cases a lot more often compared to the other cases. So the table that is shown here, this is for the most recent, so 2021, 2023, that you can see. In addition to multi-state, that we cannot really determine the population, but these are the states that are having high number of outbreaks per million per year. When we get to E. coli and Salmonella, we find really interesting results. So the top figure is showing outbreak count. The bottom one is showing it's a scale by the population, so it's outbreaks per million. And we see that these states are always on top of the list. So Minnesota, Ohio, Oregon, Wisconsin, and Idaho. And if we compare this to Salmonella, we see same thing. So Minnesota, Ohio, and Oregon are top 3 states in terms of number of outbreaks or number of outbreaks per million that are happening. So, and why is that? So there could be multiple reasons. So maybe reporting more efficiently, or maybe presence of some farms in those regions. And yes, itself can be a study by its own, so that we have to figure out why we have more cases of Salmonella and E. coli outbreaks in those states. So moving forward, we also looked at the location and primary mode of transmission for E. coli and Salmonella. And as expected, food is #1 factor for mode of transmission. But in addition, we noticed that person-to-person and animal contact are important. On the right-hand side, we can see that many of those cases are happening in the private home or restaurant and banquet. So this includes all places that provide food, and other cases is the third, and then daycare and preschool, festivals, grocery store, and so on. One thing that we need to pay attention is that because of different labeling and different forms of reporting, some of infections associated with E. coli are such as UTI or sepsis or other ones are not labeled as E. coli cases of outbreak. Therefore, you can see that nursing home and hospital have really low number, but in fact, there are different surveillance systems that are recording those cases. So it's not necessarily presented in this data set. So now that we studied the data, now we want to spend a little bit of time and learn about modeling, and in particular, modeling One Health, basically One Health modeling of Enterobacterialis, which includes both includes people, environment, and animals. So these are all connected to each other when it gets to Enterobacterialis. So there is also a complicated diagram of cases that we see that how hospital, community, wildlife, and farm are all connected to each other. This is coming from a paper published in 2015, and how antibiotics used in each of these sectors, including hospital, community, and farm, can actually cause a huge increase in the case of antibiotic resistance. And actually, the final suggestion of this study is that these sectors need to work more closely together to prevent or reduce unnecessary use of antibiotics. When we get to the modeling, One Health modeling for complex dynamical dynamics of antibiotics. So we can actually see that starting from the left-hand side. So we have a complicated network that is including environment, human, and animal. And then we can use AI, but we have to be very careful. So that's why I put the term AI enabled, not AI driven data decomposition. So there are multiple types of data that can be decomposed. The data that I showed is just one of the many data that we have available. So we have wildlife distribution data, livestock, human movement, vector distribution, and so on. So once we get this data, we can actually use it to understand, to better understand the disease transmission cycles within and between species. So we have human, wildlife, and domestic animals, and poultry and farms. So these are all connected to each other in one big system. The other factors, so after we look at these decomposed data and also transmission cycles, there are two major issues that we have to deal with. Issue number one is mislabeling, that it's always happening. And issue number two is missing data. So this itself requires a lot of data imputation and correction before doing modeling, because if we don't have the correct type of data, then we cannot really do a good job regarding modeling. And if we are successful with our predictive or analytical modeling, then we can use that model for optimal control or developing policies that can help us reduce the occurrence of antimicrobial resistance. This is another way of looking One Health modeling, which is described as Swiss cheese modeling. So for a pathogen to pass from its environment to host, which can be human, it must pass through multiple barriers. And this is a paper published in 2017. This diagram that we see here is, in fact, is coming from that paper animation that we see. And it's basically showing that all of these holes should be aligned together so that an outbreak happens, or pathogens, which are zoonotic pathogens, so basically Salmonella and E. coli, that are primarily coming from animals, can actually pass through all of these barriers until they can make their way to the communities and hospitals and nursing homes. Here is another view of Swiss cheese model. And the factor that we like to emphasize here is effects of individuals, so their actions, and that includes proper hand hygiene, screening, isolation, and physicians when they don't prescribe antibiotics unnecessarily, or safe food handling. So all of these factors are associated with human behavior. In addition to that, we have institutional actions, which are basically educating the workers, enforcing protocols, and so on. So these are really important factors that can be used in our modeling and can make our models more realistic. So if we look at all these sectors, farms, hospitals, nursing homes, there are big similarities between all of these sectors, which can give us the hope to have a One Health modeling that can include all of these sectors. And if we look at it, they all have staff and resident populations. Antimicrobial resistant organisms are present in all of these. And staff must follow certain biosecurity measures to prevent outbreaks or other cases that can happen. And the shared environment can be a reservoir of infection for all of these cases. So if these environments or these sectors have so many similarities, why don't we put them all together and try a modeling in the form that we see here? So we have within each environment modeling, which is coming from this structure. So we have healthy residents that they can become sick, and unhealthy residents can make healthy staff sick, and this cycle can keep going on. And then we also have the shared environment that can be a source of infection spread. Between environments, so we can actually see that we have connection between farm and community. This has been well established. Community to hospital, that they can influence each other. There are many papers that is describing this type of dynamics. There are many models associated with that. And we do have these dashed arrows here. So what are these? Is there any connection between farm and hospital? Can cases of infection in farm have anything to do with the hospital? So this has been a question that the scientific community has tried to answer. So this is one of the studies published in 2019 that is actually comparing, is basically genomic surveillance of E. coli and farm hospital pathway, which is basically showing that, yes, there is a pathway, and probably is not the #1 pathway, but there is a connection between farm and hospital. So this is a diagram from that paper that is showing among these 11 hospitals and 26 different farms. So hospital 5 and hospital 10 have some connections to the network of farms, and different colors are showing different animals in different farms. So there is that connection, but the connection is not that strong, but it can become stronger if we don't follow the biosecurity measures. So with all of these introductions, now we get to case study 1, which is focusing on farm community modeling of Enterobacterales. And we will focus on Salmonella as a pathogen in this case, because that gram-negative family of pathogens includes so many other pathogens. And for this modeling, we use ordinary differential equations and stochastic differential equations, which is basically in a hybrid format. The ODE model is describing how infection is spreading between animals, and SDE is representing the spread of infection within the farm workers, and the connection between the two, which is, in fact, we assume just one-way connection. We assume that animals are mostly causing infection for human, not the other way around. It's not that it's not established, but there are very few cases that are documented that human can make the animal infected in a farm. So the case study is basically how would the actions of farm workers impact local dynamics of AMR enterobacteriosis. And we study a dairy farm for Salmonella outbreaks, and we want to see how it impacts the farm workers' health. This has been already published in One Health, so you can actually find the details of that. And choosing the correct type of model is model structure is the #1 factor. So there are many compartmental models to choose from, but because this is Salmonella, so it makes sense to go with SIR or SIRS, or cases that has recovered. So if it's E. coli, then we have to go with SIS. So I guess many of us are familiar with these compartmental diagrams. Maybe another format to look at is Erlang SIR model that is suggesting that you can actually have, instead of exponential distribution, you can use the Erlang distribution, which can make your model more realistic. In the recent years, you can see that there has been lots of activities to bring in this sparse identification of nonlinear dynamical system, which is known as SINDI. And this has some good and bad outcomes. So it is very sensitive to noise and the type of data and the way that we are introducing the library of models. So that's another thing that the CDC predoctoral fellows are working on now. So here is a simple diagram of ODE-SDE model for Salmonella spillover. So you can see that animals can cause infection in the farm worker communities and also within animals. So between, so these species can also grow between animals and also can cause infection in that population as well. So we have two types of pathogens. So we have shown that with 1 and 2. 1 is for drug susceptible, and 2 is drug resistant type of Salmonella. So with that being said, we also have the P1 and P2, which is the pathogen in the environment. Again, so drug susceptible and drug resistant type. So one of them is antibiotic resistant, the other one is not. And they can actually influence both populations, animal and farm workers. Again, animals can make the farm workers infected. The reason that we chose stochastic differential equations here, because the population of farm workers is much less than animal population. So animal population, we're talking about the scale of 3 to 500 or even 1,000 animals, but farm workers is maybe 30 or around that number. This is a more detailed form of the hybrid model. So you can actually see it's including lots of parameters there. So to study the effects of these parameters, we did run global sensitivity analysis, and we found that the direct transmission rates are the most influential factors. So on the left-hand side, we see that the ODE model is describing how pathogens can spread in the animal population. And then on the right-hand side, we can see that how the spillover can happen, and it can make the farm workers infected by either drug susceptible or drug resistant types. So if it's drug susceptible, that's not a major issue, but if it's drug resistant, then it can be deadly. So that's very crucial. So we did have some model validation. This was a partial model validation, and the reason for that is that there is no data associated with farm workers. To the best of my knowledge, that data is not available or is protected. Therefore, we validated our model according to data for infected cows and the pathogen in the environment. So the model is doing a decent job. If you look at the R-squared, so you can actually see that among different candidate models that we had, we can get to 0.8. And the lowest that it can get is 0.64. So it's doing a decent job. And for the part that we didn't have the data for farm workers, we used expert opinion. So we appreciate the collaboration with the UC Davis veterinary medicine the school, that the two of their professors can actually help us, Professor Sharif Ali and Professor Pranav Pandit, that they are collaborating with us on this project. So using their expert opinions, we could actually parameterize the parameters associated with the farm workers. The basic reproduction numbers, so this gets a little bit mathy here for those who are not familiar. Maybe this is a little bit challenging, but basically to calculate the R naught, there is a method known as next generation matrix approach. However, in this case, we get to different interpretations of next generation matrix. So we have 3 different next generation matrices. So then that'll give us 3 different R naught values, which can be a challenge. because we don't know which one to choose if we don't know their properties. So that has been shown with R0 1, 2, and 3. I is representing the reproduction number associated with the drug susceptible and drug resistant types of pathogen. And the R0 is basically the maximum between the two R0s, R0 for drug susceptible and R0 for drug resistant. The type 1 that we see up here, it has a very nice simple structure. It's just shown as contribution from the environment, indirect contact, contribution from direct contact, and contribution from the environment. So this R0 is valid only if the R0 for the environment is less than 1, or else it doesn't make sense. So in that case, if it's greater than 1, then what happens is that the growth in the environment, pathogen growth in the environment, is so much that can make everywhere infected. So for R0 2, it's more complicated. So you can see that it is coming from a different interpretation of F and V matrices, and R0 3. So this has been studied previously in the work with Pauline van der Riesche. We published this paper in 2012, so we knew what to expect from these. Good news is that all of these three reproduction numbers agree on the threshold value 1. Also, we can see that the second interpretation is always between the first and third interpretation. So we choose R0 2 as the one for doing our simulations, because it's more reasonable in the sense that it's always between the other two. So now, in terms of studying the actions of farm workers on how it impacts livestock and rural community health, there are 6 different biosecurity measures. These are coming from realistic practices done in the farm. So animal control and quarantine, disease monitoring and reporting, hygiene and disinfection, feeding and watering practices, antimicrobial stewardship, and contamination management. So if you look at these 6 biosecurity measures, more or less similar things can happen in a nursing home or in a hospital. So there are lots of similarities there. Challenge here is that if we go with different scales of good, excellent, marginal, and low, then we're talking about 6 to the power 4 possible cases. That's 1,296 cases. And even if we run only 2,500 simulations for each case, so we get to 3.24 million simulations for validating the model and understanding what will happen. So doing that, we studied different scenarios. Scenario 1 is basically reducing direct contact. Scenario 2, reducing indirect contact, increasing pathogen removal from the environment. That was scenario 3. And you can see that scenario 4 is for reducing the use of antibiotics. And scenarios 5, 6, and 7 are combination of these cases. But if we look at all of these, so if we increase, for example, from low compliance, that L is for low compliance for the direct and low compliance for indirect, to good and excellent cases for direct, we can right away see that the reproduction number comes down quite a bit. So when it gets to good, you can see that it is hitting almost the good and excellent. It is going actually below or not equal 1, and good is slightly above 1. And you can see that excellent and excellent is probably is feasible if there is money or resources for doing that, but even excellent and good can reduce the likelihood of outbreaks. The two columns that we see here, one of them on the left-hand side is for are not associated with drug-susceptible pathogen, and the right-hand side is for are not associated with drug-resistant pathogen. So they're consistent, so we can see that the different combinations have different impacts in terms of reducing R naught, but the number one factor is reducing direct contact between animals that can actually reduce the likelihood of outbreaks. In the population of farm workers, we can actually look at all of these cases. These are the worst case scenarios that we can see the prevalence of infection can get even to 80%. That's for the cases that everything is poor. So poor animal handling, poor compliance with the biosecurity measures can directly impact the rural community. And this way we can actually quantify how much of damage is caused by failing biosecurity compliance with regard to those 6 cases that we studied. So in summary, we can say that the farm workers are the front line in terms of preventing outbreaks associated with Salmonella. And a similar study shows same thing for E. coli. So farm workers' actions are extremely important to protect not just the rural community, but also the entire public. So in the population of cattle population can also, we can see that the worst case scenarios are there. So it can get to 67% for drug susceptible outbreaks caused by drug susceptible pathogen. And this is cumulative incidence rates, which is clearly showing that compliance with biosecurity measures can impact the animal population and also the rural community. In terms of use of antibiotics, as expected, there is a threshold for use of antibiotics. So these 2 thresholds are according to the parameter values that we chose. But in general, the big message here is that sustainable or optimal use of antibiotics is not just dependent on the microbiology of pathogens, but also factors such as prevalence of resistant strains, farm size, compliance with the biosecurity measures, and pathogen-specific environmental conditions can influence this threshold. So in a farm that biosecurity measures are strictly followed and farm size is small, is not a big concern, as opposed to a farm that has lower compliance with the biosecurity measures and is excessively using antibiotics, then that's a huge concern in those type of farms. So again, the big takeaway from this study is that the optimal use of antibiotics is not just dependent on microbiology, it's also dependent on farm size and compliance with the biosecurity measures. This is concluding the study number 1. I know that I have to speed up because I have about 15 minutes. So case study 2 is basically talking about the UTI, because the primary cause of UTI is E. coli. And we study that, we use machine learning for this study to understand how basically care for vulnerable population can play a role in nursing homes, and also socioeconomic factors if they have anything to do with the UTI in nursing homes and hospitals. So the background here about the UTI, it's commonly caused by E. coli. That's why we're interested to study this. When it gets to the nursing homes, we can see that approximately 25% of older population in the US will reside in a long-term care facility at some point. And many of them, unfortunately, will have to deal with UTI. In fact, UTI is the most common cause of hospitalization for bacterial infection, and it accounts for 1/3 of hospitalization hospitalized patients from long-term care facilities. And another factor here is that antibiotic use is a lot. In fact, 30 to 50% of antibiotic use in long-term care facilities are for treatment of UTIs. So optimal use of antibiotics is really important when it gets to UTI. We looked at the data from CMS and applied the machine learning to understand or to find the facility level and resident level predictors of UTI in nursing homes in the whole US. The data is from is very recent, so it's 2023 to 2025. Is missing the month of December, but all other months, so 22 months are available there. It has 51 variables. It includes facility type and workforce quality and all factors associated with the nursing homes. And here it is. So what we did, we used the dependent variable for UTI with a threshold of 3%. So any facility that had UTI more than 3% received a 1, below 3% received a 0. And you can see that the specificity of the models are good. Sensitivity, it gets down when it gets to November 2024, but overall, they are 80% or above for most of the cases. So it's reliable in a sense, and these are classification and regression tree models, which is generated by MATLAB. And the factors that are associated with prediction of UTI, you can actually see that the quality rating, staff rating, and all of those factors are really important. And when we say care for senior residents is really important to prevent UTI and also complicated UTI, the data speaks for itself. So the models are actually showing that these are the key predictors. So the importance of this study compared to the previous studies is that this is studying facility and resident level UTI predictors compared to previous studies that are mostly focused on demographics or individuals, basically patient level predictors. This has also been supported by literature. So there are studies that are showing these things. We also studied hospitalization for long stay residents. We found that, again, using machine learning, we saw that a lot of short stay residents impact the long stay residents. So that was also another nice angle of the study. UTI in the hospitals are also something that caught our attention. A recent study is showing that ESBL producing UTI is increasing across the country. And you can see in the middle of the map, so Kansas City, that's where we are, the number that from that population, so 13% had that case of ESBL producing UTI. Because of that, we did a follow-up study. So we received the data from Truman Medical Center or University Health, so which has 2 centers. One of them is in Lakewood. The other one is in downtown Kansas City. And we studied, we wanted to know if socioeconomic factors are predictors of UTI. And socioeconomic factors, the reason we looked at it because these 2 facilities are known as safety net hospitals. So majority of patients are underinsured or uninsured or low-income patients. So that's why we wanted to know if socioeconomic factors are predictors. Models have good accuracies, but socioeconomic factors were not primary predictors of UTI. Community associated or healthcare associated. So for those, it was not, they were not primary predictors. They were important, but not on top of the list. But to summarize all of this, we see that in hospitals and also nursing homes, quality of care and quality of nursing home and the facility are really important predictors of UTI. Again, that's a different angle compared to the other studies that are mainly focusing on the electronic health records of patients. Finally, we get to the third part. This is a farm community hospital modeling of Enterobacterales. So we go back to E. coli. And for this, we use SDE hybrid modeling. And this is a work in progress. So still there are some parameter values that have not been fully studied. So initial results are shown here. So the question is that how would ESBL producing E. coli outbreaks in farms or communities influence the incidence of healthcare associated infections caused by ESBL producing E. coli? This is a diagram for the model that is basically showing how farm, community, and hospital can be connected to each other. We did not draw a connection between farm and hospital, despite the other studies that they show there is a weak connection, but we assume that that connection is negligible. And here you go. So the study that is basically through tens of thousands of simulations, we can see that an outbreak in a farm, in fact, AMR, which is antimicrobial resistant outbreak in a farm, can cause a lasting impact, lasting outbreak in a community. And eventually, it can get to our healthcare system and it can cause outbreaks in there. The numbers here are basically very small numbers because the population that we looked at, it was a small population. So you can see that 10 infected animals can result in 5 infected and in a case. So this can be interpreted as endemic situation. So something like 4 infected individuals in a community and a big snowball effect in a hospital that can go even up to 11 infected patients with the antimicrobial resistant type of E. coli. Community outbreak, again, it can have a snowball effect on the hospital, but it does have minimal impact on the farm. So summary is exactly what I just said. So the snowball effect is in there. Farms and communities can directly influence the outbreaks of ESBL producing E. coli or UTI in hospitals. So concluding remarks is that One Health modeling supports AMR mitigation by predicting resistance, evolution, and optimizing those thresholds of usage of antibiotics, and also strengthening the coordination among all of these sectors that includes human, animal, and environment can be extremely helpful for reaching optimal health in all 3 sectors. With that being said, I'm done. I'm happy that it's right now it's 5 minutes left for taking any question.
Great, thank you. Interesting talk. I'm trying to think about the dynamics of transmission across those 3 groups. And I want to offer first, if anybody has any questions, please do put something in the chat or in the Q&A. We'd be happy to take them, but not seeing anything, I'll just start off and say, how easy or hard is it to get good numbers on the contact rates and the vectors for transmission between those those 3 groups of farm, community, and hospital?
That is exactly the key point here. As of now, we have different organizations and data is scattered. So CDC is collecting some type of data, USDA has other type of data, and there are some data that is from individual studies available in the literature. So that is the part that is actually missing. So strengthening coordination among these sectors can actually help us a lot to understand how infection can go across one environment to another environment.
So I assume a part of that would then also be sort of doing some sort of a sensitivity analysis on some of these parameters of
That
different rates and seeing how that impacts the outcome.
that is the usual way to do. Yes, sensitivity analysis is the standard approach for understanding the key factors. However, having the right type of data is also important. So we focused on E. coli and Salmonella because these two pathogens have been around and they are impacting all three sectors. And they appear in different forms of infection, such as sepsis or UTI and all of that, which is causing a problem because those infections are not recorded as E. coli outbreaks or things. So that's hard to gather all of that data. Yeah.
So the other related question that comes up here is that I was just wondering about, have you explored any time agent-based models here to get at some of these finer grain dynamics? Because certainly the compartmental models are simpler in some ways, but it would be interesting to sort of get at some of those dynamics, particularly when you look at the small numbers to see what it takes for things to go from one community to the next.
That is an excellent point. In fact, agent-based models are really useful. However, issues with agent-based models are basically those assumptions that we make that how these infectious agents are meeting a susceptible agent. And if we don't have correct type of data, it becomes very challenging to get something meaningful out of it. In a different study that we applied last year in Truman Medical Center, we used indoor GPS data to track healthcare workers and medical devices. And the idea was that how does infection spread with contaminated medical devices, and what is the role of healthcare workers, and can we define ways to limit their unnecessary movements or unnecessary visits so that we can reduce the likelihood of infection spread. So even at that study, I mean, there are different research groups that are working on that. University of Utah, University of Iowa, they're also doing the same thing. The University of Missouri, Kansas City, we are also collecting that type of data. That data has a lot of noise, which causes a lot of problem for correct type of agent-based modeling. So I'll be happy to present that other study as well, but it's doesn't fit in this scope of this study. Yeah.
Yeah, and that sort of gets to my last question, which maybe we can just take a second here. I know we're at the top of the hour, but it seems like there are a significant number of policy implications that could come out of this work about how you run your farms, how you run your hospitals, et cetera. Are you engaged with policy people to try to use these models to inform how they think about these things?
More importantly, we are interested to put them all in the same room so that we can talk to each other.
That's a very fair point. Great. Well, it's the top of the hour, so I think we should respect everybody's time and call it quits. Majid, thank you for an interesting talk. Really appreciate the different perspective, and I like the idea now I'm going to have to give some more thought to this notion of moving between these communities and what that means for health outcomes. But I think we can all see that there are really some important issues here, and that certainly as long as you're working in AMR world, you're not going to run out of timely and interesting problems to be tackling. So we look forward to hearing more. So thank you very much. Folks, we're going to take off the month of August as we tend to do, no webinar, but we'll see you back here at the end, towards the end of September with our next talk. And everybody have a great summer.
Thank you.
Thank you, Majid.